Hi guys! So I thought it would be useful to make a video about how you can adapt the traditional Achilles tendon exercises, the heel raises, to suit your body, because there's a lot of people who can't progress through the rehab program using the traditional single leg heel raises with weight and things, because there's just other parts of the body that doesn't allow it. So if this is you, you may find some use from this video. So for those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your Achilles injuries. Have a look at the description of this video if you want a link to our website. Okay, so a few reasons why people may struggle doing heel raise exercise when they have an Achilles injury. Now, anything that's going on in the front of your foot, so the ball of your foot, can really limit your ability to do heel raises. So two of the most common things that I can think of is if people have a neuroma. So that's where you've got a nerve ending between the two bones that has kind of formed a little knobbly bit that's very sensitive to compression. So going up and down on your toes can be really uncomfortable for that. Now, I had an interesting case recently where we could load the person up in double leg heel raises and could go quite heavy. But as soon as we went to single leg heel raises and without extra weight, that would really aggravate that pain in the front of his foot. And it came down to the fact that when you have your feet in double leg support, you have certain biomechanics and you can go through the middle of your foot and really control where the pressure goes through the foot. But as soon as you go in a single leg, even if you're holding on for balance, you have to shift your body weight over to balance on one leg, or to be able to stabilize yourself on one leg. And that immediately creates a slight more angular force, which can cause the bones in the front of the foot to compress a little bit more. And for him, that would flare up his neuroma time and again. Now, fast forward a few months, and what we've had to do is just stick with the double leg heel raises and just start loading him up. So we loaded up with loads of weight, according, of course, to what his Achilles could tolerate and what his foot could tolerate. And lo and behold, he's now able to start doing some single leg heel raises. But the other thing that he found was that he's okay coming down, so eccentric drop, but not quite lifting up yet. So now he's progressing from doing the double leg with weight to actually doing the typical eccentric protocol because his foot accepts it. So that's just one example of how you can kind of develop your program to suit your body. So don't try and force your body to fit the program. Make the program fit your body. And there's plenty of ways to go about that. And just by the way, he's already back running pain-free in his Achilles, despite the fact that he can't do a single leg heel raise up and down because of his toe. So he's got the base strength that he needs. And remember, when we run, we don't actually run through that whole motion of up on your toes as high as you would go when you do a heel raise. So for most people, if you have issues with the front of your foot, although it would be better to do a full heel raise, what you need functionally is just quite a small lift. And if your foot naturally gets painful because you're going through the full range, I'm going to bet good money on the fact that you don't actually need full range when you run, or don't use full range when you run. So there's no need for us to strengthen it that far if it's just going to upset your foot. Now, the second thing with that is that you have to look after the metatarsal bones or heads of your feet. So often people feel that they want to do these heel raise exercises barefoot because they can feel better control. But now there's not a lot of padding under this part of the foot. And if you're going to do it on a hard surface with bare feet, you can very likely irritate these joints or the metatarsal heads. And you can get a condition called metatarsalgia, which is just a fancy name for you've squashed this too much. And now the bones, the tendons, everything becomes sore and aggravated. And that can take a very long time to calm down. So get into the habit of, if you're going to do your heel raises and you feel any sensitivity, but to be honest, these days, as a measure of precaution, I get all my patients to put padding under their feet. So if you're at the stage where you're doing your heel raises with shoes on to floor level, perfect, because it's padded. If you're doing it at bare feet, you have to have a yoga mat or something soft under there that allows you to be padded. If you're doing it over the side of a step, put your shoe on, because you're not going to lose any range of motion. and the shoe will help to pad that bit. Now, if we think of other things that I've seen people struggle with, so you'll often see that programs involve bent knee heel raises plus straight leg knee heel raises. And yep, if we want to go on technically which parts of muscles fit into the Achilles tendon, it is, you can argue, important to strengthen the soleus muscle through doing bent knee heel raises as well. But to be honest, if you've got a knee, especially a knee cap, that can be quite sensitive to compression forces, you may run into trouble doing those, especially if you're doing them without a machine. So when you're doing bent knee heel raises standing up, that can put huge forces through the knee and be the reason why it becomes painful. So if you have a painful knee that doesn't like that, leave them out. I have got people back to full running without ever doing one bent knee heel raise, as long as you load the other ones up properly. Or if you've got the ability to go to the gym and there's one of those machines where you can sit down and do the bent knee heel raises, the knees are usually happy with that because that doesn't really load the kneecap. So that would be a good option if you wanted to do that. I don't find that you can successfully load the knees heavy enough in the seated position at home safely using weights. So it's either the machine in the gym or it's just stick with straight leg ones and make sure you make them count by making them heavy enough. Okay, so that's the main things that I wanted to share today. But the main message is look after the balls of your feet and look after the front of your feet. Because when that gets angry, it can really derail your training program as well. And there's plenty of ways to adapt the method that you get strength into your Achilles tendon. You've just got to experiment a little bit and see how you get there. Hope this is useful. Let me know if you've got any questions. And if you need more help with an injury, you're welcome to consult one of us via video call. Link is in the description of this video. Take care.